TGF. Thank God it's Friday. Good morning. Good morning. This is Dr. Yonnette. Look, I am so looking forward to this weekend. This weekend, my baby turns 18 on Saturday to be exact. So I'm excited. And between celebrating and having fun as young people, you know, the preponderance of people who go towards alcohol and drinking has been staggering. There's so many reports of people on campuses that have been overdosed by alcohol and have these terrible, terrible experiences. So in the context of baby talk and alcohol, I want to bring this topic to your attention because a lot of drinking becomes a habit when you are young. Alcohol consumption happens when you are young. And a lot of times we are not careful to note how it affects the fetus, how it affects our babies, how it affects our children in later life. So today I'm sharing with you information from the CDC about fetal alcohol syndrome or spectrum disorders. And this is really a group of conditions that can occur in a person who was exposed to alcohol before birth. And these effects can include physical problems, problems with behavior, and problems with learning. And oftentimes what you will find that a person has a mixture of these problems. So what would cause a child to end up with fetal alcohol syndrome disorder? Now, this occurs when a person is exposed before birth, like I said earlier, when the mother passes the alcohol through the blood in the baby, through the umbilical cord to the baby. And this is not known. There's really not a safe amount of alcohol during pregnancy or when trying to get pregnant. So you want to make sure that you stay away from alcohol. So there's no safe time to drink during pregnancy. I'm saying that again. There's no safe time to drink during pregnancy. Alcohol can cause a lot of problems with your developing fetus, and it can include alcohol such as wines and beers. So remember, there is no safe time to drink when you are pregnant. And I want to push it a little further and say even when you're considering becoming pregnant. So as a woman pregnant, you should avoid alcohol at all times because it can get to your baby, okay? And it's never too late to stop drinking during pregnancy. So if you found yourself in a situation where you have been drinking and pregnant, it's time to stop. You can stop today. Ideally, you should not have started, but if you are there, this is the best time for you to stop drinking and give your child a chance. What are some of the things? What are some of the symptoms that you would expect to see in a child who was diagnosed with fetal alcohol spectrum disorder? The person might have low body weight, poor coordination, hyperactive behavior, difficulty with attention, poor memory, difficulty in school, especially with math, learning disabilities, speech and language delays, intellectual disability or low IQ, poor reasoning and judgment skills, sleep and sucking problems as a baby, vision or hearing problems, problems with the heart, kidneys, or bones. Oh my goodness. Is it worth it to have a glass of wine when it's going to end up affecting your baby so profoundly? Shorter than average height, small head size, abnormal facial features such as a smooth ridge between the nose and the upper lips. Think about it for a moment and tell me if you would want your child to have all of these symptoms, these experiences, negative experiences, because you drank during pregnancy. And this habit of drinking begins in your youth. So you want to make sure that your child is being instructed appropriately. So when he or she gets to the point of wanting to become pregnant and raising children, that he knows or she knows what's appropriate to do. So let's see how is fetal alcohol spectrum disorder diagnosed. Fetal alcohol spectrum or syndrome represents the most involved end of the spectrum. When the child has the syndrome, it's like the end of the spectrum. You know, a spectrum is a long line. You have different points on the line where, you know, it might be mild, it might be moderate, but when the child has fetal alcohol syndrome, it's like way at the end of the spectrum. And so the central nervous system problems kick in. There is minor facial features, and then there's also growth problems. So these individuals have problem with learning and memory and attention span and communication, vision and hearing. And you want to make sure that if your child is diagnosed with fetal alcohol syndrome, I mean, the deed is already done, that you are helping your child to get the kind of support he or she needs to be able to function. And there are many types of treatment options that are available, and they include medication to help with some of the symptoms. There is behavior and education therapy. There is parent training, and there's also the alternate approach that you can use to help your child who was diagnosed with this disorder or the syndrome. Now, usually you will find that a child with the spectrum or the spectrum disorder or the syndrome is diagnosed before the age of 6 years old. Okay? So you want to make sure, again, I'm going to say this one last time, you want to make sure that if you see any of these symptoms or features in your child, that you are going to be addressing it with your child's pediatrician so that help can be provided. Now, in, you know, a lot of the conditions that I've been talking about are conditions that happen without your impact. You know, there's some abnormality that took place. I mean, within the gene, or, you know, the combination of your gene and your spouse's gene resulted in your child having some syndrome or disorder. But when it comes to alcohol, fetal alcohol spectrum disorder, it's all you're doing. And it's an easy way to prevent. To prevent this disorder, you just stay away from alcohol when you're pregnant. And try to practice good habits even before you are pregnant, so that at that point when you are carrying the baby, you don't have the temptation to drink. This is Dr. Yonnette saying to you today, take care of yourself. Be healthy. Put healthy things in your body. Take care of your skin. And take care of your baby. Give him or her the fighting chance that he deserves, that she deserves, to be the best citizen in this life. Thank you for joining me today, and I look forward to seeing you tomorrow for Read Time with Baby.